Thank you very much, MEC. Before I just even respond to the issue of the TB medication, I just want to confirm so that we dispel the myth around the issue of generics, that there is a national policy on generics, and that policy says it's a policy for classifying medicines into therapeutic classes for purposes of therapeutic interchange, which means it's a policy issued by the National Department of Health. It complies to all the pharmaceutical regulations about rational use of medication. So it's not something that we've just come up as a province or so. It's a policy that you are allowed to dispense generics for purposes of therapeutic interchange. Now, when it comes to the TB medication that we're talking about, yes, we do have a problem with some of the TB medication, which is rifampicin, because the supplier or the manufacturer does not have what I refer to as active ingredients in order to manufacture that type of medication. However, again, we do have the alternative or generics to give to patients. Thank you.